record? All right, here we are, Tuesday, August 29th. For those of you that don't know, I am Jane Voorhees, one of the admissions representatives here at Sonoran University, helping you guys get ready for a successful interview experience. So get those transcripts over to us. Jody and I will review your application, give you some tips, really help you prepare for that moment. And we are excited to have you join our community. Outside of Sonoran University, I am a live entertainment junkie. I like sports and concerts and all kinds of anything that's outdoors and real people are doing it. I'm super impressed. I'm learning a little bit about esports, but I feel like you've really got to be physically moving to really enjoy it. So I've been at Sonoran for a cumulative total of 10 years. I love this community and I'm so grateful every day that I get to work with Jody Durham. She's amazing. I'm gonna let her introduce herself.
Hi, everybody. Good afternoon. Thanks for joining us. My name is Jody, like Jane said. So I'm the other admissions rep. So I work with the beginning of the alphabet, A through L. But any of you guys can give me a call if you have questions on anything. I'm originally from the Midwest, so originally from South Bend, Indiana. Moved out here about 21 years ago. Absolutely love the valley. I can say I love the heat. I honestly do. So don't hate me for that. But absolutely love what I do here at Sonoran as well. I just celebrated my 17th year here at Sonoran. So I cannot imagine being anywhere else. I honestly, even after 17 years, I wake up every day looking forward to coming to work, and especially working with Jane. I'm so glad that, she's my partner in crime here because we have the same mindset. We want the same thing, so it's great to work with somebody that is, on the same page as you are. So welcome. I hope you guys have fun. Turn on your cameras. Let us talk to you, face to face. That's always more personable. We have a great speaker here today. So lots of exciting things happening. So as you all know, I usually share a core value. Core values, of course, are beliefs of our organization. Today, I picked We Achieve Excellence. So Sonoran University is constantly striving for excellence and is always looking to improve our facilities, our curriculum, our teaching method, and skills of our faculty, as well as improve our community around us. So that's one of my favorite core values. I also want to share with you guys, we've just kind of adopted a new mission statement. So this is very important to us as well. So I just want to read the mission statement to all of you so you can see how this resonates with Sonoran University. Sonoran University of Health Sciences shapes a healthier future by supporting students as they train to excel as healthcare professionals, by enhancing the health and well-being of our patients and communities, and by discovering effective treatments for humanity grounded in the healing power of nature. So we're very proud of that new mission that we've just recently brought on. So, all right, you guys have fun with this. That's enough for me.
Thank you for that, Jody. For sure, that's a wonderful new mission statement. And I think for sure what we're doing here with Live with Jane and Jody, just sharing with you guys the community that we are creating every day. I think the mission statement is catching up to who we are. Like what we've been doing for these 20 years has been solely focused on that naturopathic degree. Now we've expanded and we have research. We have so much exciting things happening here. And today we're going to have an incredible conversation with Dr. Havens, who, I mean, speaking of excellence, like I think that was the perfect core value to choose for today. You guys are just going to be blown away today when you hear from Dr. Havens. So I want to do a great intro. So first, though, I do want to remind everybody we are recording this session. We do love it when you turn on your cameras, ask questions of our guest speaker. Jody and I tend to, we've got a couple questions queued up to kind of get the ball rolling, but these sessions are for you guys. We want to hear from you and we want you to be engaged. So, or of course, use the chat feature as well. Type some questions in there if you're a little shy. And Zoom is awkward. We get it. So it's kind of hard to interrupt somebody. So type your questions in the chat and we'll make sure we keep an eye on that. So let me tell you about Dr. Jennifer Havens. We've got create a wonderful bio here. So, born in Arkansas, but she grew up in Philadelphia. So she has actually been coast to coast. You're going to hear all about it here. She's got two bachelor's degree, a BA in English and art history, as well as a BS in biology and chemistry. And right off the bat, that's what piqued her interest in the oncology and the cancer path. She took a gap year post baccalaureate to do some cancer research specifically. Then she also went to attended University of Virginia to start grad school in cancer biology. But then she came to Arizona to pursue specifically naturopathic medicine after losing a dear friend, and again in a form of cancer. I believe I researched that word, and I think it was breast cancer. I don't know. These are big words, Dr. Havens. But she came specifically with that intention of naturopathic oncologist. Like, I love her focus and intention here. Dr. Havens has done a lot of training since becoming a naturopathic doctor. She did an internship at pediatrics at Yale University, as well as an internship in general integrative medicine at George Washington University. She was awarded a National Integrative Health Fellowship in clinical research at the University of Washington. She went back to Pennsylvania to do her residency in naturopathic oncology at the Cancer Treatment Centers of America. They're now known as the City of Hope. So she went from Pennsylvania. Now she's back in Arizona, really returned to Arizona to enjoy the full scope of practice that we have here. And now she's being recruited yet again to Medical College of Wisconsin to continue to develop an integrative medical research program. And she is currently the program director at the Children's Hospital of Wisconsin. So really, what a background. We are honored to have you with us for today.
Yes.
Jeez, thank you so much for that intro, Jane.
Yes,
Just so everybody knows, these guys were actually my admissions team when I started medical school back in 1850. These guys are an institution. They have been here for a long time, and they are solid gold. I mean, really, these guys were my team when I interviewed at, it used to be Southwest College of Naturopathic Medicine, like I said, back in 1850, a long time ago. But thank you guys so much for that introduction. So what do we do now?
Right? Well, so let's start from the beginning. I mean, with all of that traveling, what really brought you to Arizona? Was it the widest scope of practice? How did you choose Sonoran? Did you apply to all the other schools out there? Like, let's just start with that first initial step.
Okay, sure. I did apply to Bastyr, and I applied to Bridgeport, which is, that school closed quite a while ago. But as I grew up on the East Coast, I thought Seattle might be interesting because I actually hadn't been there. I actually had never been to Arizona before I came and interviewed for medical school. But really the driving force for picking Sonoran was that my father got diagnosed with stage 4 lung cancer 6 months before I started medical school. So it was really, there was no other school for me to choose because I could take a nonstop flight back and forth from Little Rock to schools, which is what I did. He passed away my second year of medical school. So I went every weekend, I went home. So it was a really easy transition. But, in retrospect, knowing that the scope of practice is as broad as it is, really training at Sonoran gives you a much wider, I think, lens to see how we can use naturopathic medicine integratively in the conventional realm. And you're not really going to see that at the other schools. And I can say that in retrospect now, simply because I've been to the other places. I actually trained my fellowship in Seattle. So I got to be at Bastyr quite a bit and be at the clinic over there as well. It's very different. I mean, the scope of practice is similar at Bastyr comparatively for Sonoran, but you do have a broader scope of practice in Arizona. So that actually really shifts your training during your clinical years in the clinic. You're going to see a lot of different cases that you wouldn't necessarily see in Seattle, simply because of the scope of practice and just the way that the state recognizes you as a physician. So yeah, I mean, I would say certainly if you're looking to see a lot of cases and really approach things from more of an integrative aspect, because all the schools have a different personality, right? We're kind of known in the naturopathic realm for being a lot more integrative. because we do interface with the conventional community a lot, because there's a school here in the Valley. So we interface with a lot of the medical centers in the Valley. So really have I would say more of an integrative kind of slant. If you go to Bastyr, their background was really in physical medicine, NUNM, that's more nature cure. So everybody's got a little bit of a different personality. But if you're looking for more of a conventional slant, an integrative slant, Sonoran's definitely going to be the choice for you guys.
That's really well said. Thank you for offering that perspective
Very
of
good.
Sure.
Yeah.
personalities of the different schools. I love that.
Yeah, they
Yeah,
really
yeah.
do. I mean, it's,
Mhm.
the states that the schools are in and where we're licensed, they all envision naturopathic physicians it a little bit differently, right? We're licensed in every one of those states, in Oregon, Seattle, Arizona, as primary care providers. But the way that looks in terms of practice is a little bit different. So when you guys are looking at schools and looking to make choices, take a look at that and just kind of see, what really resonates with you. But like I said, again, for Arizona, it's much more integrative. So you're going to have a really good tool set on both sides of the fence. You're going to learn a lot of the conventional stuff, but you're also going to learn all the naturopathic stuff, and really a nice marriage of those two different professions and how you can utilize that as a physician.
That's fantastic.
Very good.
Appreciate it.
Awesome. Nice. So Dr. Havens, give us your opinion. How important is it for students to do a residency or complete a residency? How important is it?
Oh, I can't say how important that is enough.
Okay.
It's really, especially, I think it's really hard for you guys to think about this, right? Because you're just now applying to school, but you really
Mhm.
need kind of a long view, because what you do in medical school is really going to inform what you're doing once you finish, once you graduate. And I mean that in the sense that, for me, I was always going to do oncology. There was never going to be anything else that I was going to do, right? So I really tailored my education towards that. I made sure that I shadowed physicians that were naturopathic oncologists. I made sure, that I shadowed physicians that were medical oncologists, so I really kind of tailored my education in that regard. But a residency, I cannot underscore enough how important that is, because even though you will get a lot of hours, when you look at the breakdown of our curriculum and the training, you'll get around 2,000 hours. I think it's maybe like 2,100. It's a little bit of difference between the schools, but that's still not, you're going to feel like you don't know anything. And you really need to do a residency to get your feet. When I started
Okay.
residency, I was well trained before I started residency, but dang, nothing prepared me for the first week of residency, right? And I learned so much. And it also, when you have that on your CV, that you've done that training, you're a much better candidate to get a job. And that goes for both sides, on the naturopathic side and the conventional side, because a lot of naturopathic physicians work in hospitals, they work in medical centers. You're just going to be a superior candidate because you have that experience. Because doing a residency in a medical center where you're used to seeing a lot of patients, you're adept with the different EMRs. There's a lot of skills that you'll get doing a residency that you wouldn't get otherwise if you just jump straight into private practice. I can't say yes enough to that, Jody.
Okay. Very good. Very good. Do you feel that the residencies are very competitive
Oh,
since it's
dang.
not required in naturopathic medicine?
They're
Okay.
so competitive, uber competitive. Just to give you
Okay.
an idea, the residency, so Cancer Treatment Centers of America, when I applied for residency, they had one slot nationwide.
Wow.
And so a
Wow.
lot of these programs, they might just have one, maybe two or three. We actually have the largest residency program of all the schools. We take 5 residents. That's highly unusual. So any residency slot is highly coveted. And again, if you're interested in doing any kind of integrative medicine and interfacing on the conventional side, start doing that shadowing and training while you're a medical student, because again, you can also add that to your application for residency, and it makes you a much more competitive candidate.
Heck yeah. What's the difference in the residency and the fellowship?
For me, the NIH Fellowship, so the National Institutes of Health, they have one training opportunity for naturopathic physicians. So that's a pretty coveted fellowship to get that award. It's a bridge program between NUNM and UW, the University of Washington. It's the only NIH fellowship that exists for naturopathic physicians. That's a clinical based research fellowship. So I was doing training and learning how to administer clinical trials as a naturopathic physician, because doing clinical trials for integrative medicine is drastically different than what you would do in the conventional realm, because we have a lot more biases in our interventions. So learning how to administer those clinical trials and actually how to ask the right questions so that you can decrease the amount of bias as much as you possibly can, so that you can generate really good, solid data. So the fellowship is very different because it's strictly scientific. There's no clinical aspect in terms of patients for the fellowship, at least not for the NIH fellowship. The NIH really trains physicians and researchers to do clinical research. That's kind of the thrust of their mission. So that was the fellowship at UW was really focused on the research piece.
But still integrative. Still,
yeah. It's for integrative medicine.
Yeah. Neat.
Sure.
Neat.
Interesting.
Now, we've touched on this new opportunity in Wisconsin. So are you practicing in Arizona and Wisconsin? Or
No.
What do you
So I was on the team that got licensure passed for Wisconsin in 2021, which was a really heavy lift. But kind of the way it works with when we get a state license, there's a lag time of around 2 years. And we are just now in the process of getting that. I think everything's going to be finalized in March of 2024. But once you get the licensure passed, then the state has to ratify that licensure. And then you have to have a medical board that's formed. And we were able to get an autonomous medical board similar to what we have here in Arizona, so that it's separate from the Wisconsin Medical Association. So when you are able to ratify a board like that, it has to be state appointed. So the people that are on it, they have to kind of, lobby to be on that board. And it's a mix of different providers. So there's naturopathic physicians, there's medical doctors on there, there's some legislators. So it's a state appointed board. And then once that board is formed, then that board is tasked with creating the scope of practice. And then that goes through the legislative process. So it's a little bit long-winded, but that process is about to get finished in March of 2024. So technically, even though we're licensed, we're still not regulated there yet. But next year, probably by the middle to latter part of next year, naturopathic physicians will be able to come to the state of Wisconsin and apply for a license, which is extremely exciting. And how that kind of ties into what I do in Wisconsin. I just managed to get us credentialed in the hospital at Children's Wisconsin, and I'm working on Medical College of Wisconsin right now, which is a big deal because to get naturopathic physicians credentialed in a hospital is virtually unheard of. That means that a naturopathic physician will have clinical privileges in a children's hospital. It'll be the first time in the history of that's ever happened. So even though we might work in hospitals, most of the time hospitals don't hire us as physicians. So being able to get us credentialed in any hospital is a big deal. I'm actually partnering right now with Seattle Children's to help those guys get credentialed. Even though we've been licensed in the state of Washington for a really long time, they don't have a naturopathic physician on staff that is there as a naturopathic doctor. They're there with other skills and other licensure that they have, but not credentialed as a naturopath. So I'm trying to scale my program that I developed at Children's Wisconsin to Seattle. So we're working on that project right now, and then hope to roll it out at some other hospitals too. So I'm really active in credentialing and licensure here in the United States, which is really, really important. And I've partnered with the AANP to help those guys push licensure at a national level. The strategic plan for the AANP now is really focused on adding us to the Social Security Act. which has to happen before we can get recognized by Centers for Medicaid and Medicare Services, CMS.
Okay.
So also really active in that realm too, because it's extremely important for us to be recognized by Medicare so that we can have more training opportunities, which might seem counterintuitive to you guys now that are just really starting to think about having a career in naturopathic medicine. But the Medicare is what funds 90% of residencies for medical doctors in the United States. And that's why our residency opportunities are so competitive and so few, because, you know, they can't take a naturopathic doctor at a hospital if they can't bill for them, right? So if we're able to add ourselves to the CMS as an actual physician, then we can start having more residency opportunities and really move our profession forward. So I'm really, really a proponent of that, and work a lot in that realm for licensure and you know, getting us federal licensure.
Were you involved in DC Fly or what's the student group here that really
I really didn't,
right?
actually.
That's
it was
so funny.
super
Not
random
until later. Yeah.
Yeah, because I've never been to Wisconsin. So what had happened was, with the Wisconsin story,
Never even been.
I was given a talk at OnCAMP, and my talk was related to mistletoe and how people that have endometrial cancers do much better with mistletoe than the people that had ovarian cancer. And I had a suspicion that it had something to do with ovarian cancer stem cells, but I really didn't know, because, you know, the research that we do on our side, you know, there's not a lot of the mechanism, right? So I didn't really know what was causing this shift in, you know, the disease progression and the overall survival. So I was looking around for somebody to talk to that did any kind of research with ovarian cancer stem cells. And it was this group at MCW at Medical College of Wisconsin. So I just called them up and I was like, hey, you know, I'm seeing this, you know, I think it has something to do with stem cells. You know, I saw you guys are doing this research, like what's going on? And so I was just visiting with this gal for around 20 minutes, and she just kind of stopped in the middle of the conversation. She's like, who are you again? And I was like, oh, you know, hey, I'm Jen Hammonds. I'm a naturopathic doctor, do integrative oncology. I'm doing this talk, blah, blah, blah. And she said, well, you know, we just got this gal that we recruited from MD Anderson in Houston, and she's the chief of pediatric oncology, and she's really interested in integrative medicine. Could I give her your name? I said, sure. You know, it's like, whatever. Now, I had absolutely no expectation I'd hear from this person. So then fast forward a few months later, I got this random phone call from Milwaukee, and I was like, oh, I wonder what this is. And I answered it. So the gal on the other end said, hey, my name is Cindy Schwartz. I'm the chief of pediatric oncology at Children's Wisconsin. Do you have a few minutes to visit? And I was like, sure, absolutely.
Wow.
So we talked about CAR T therapy and a little bit about integrative medicine. And then she's like, okay, well, it's so nice to visit with you. And she hung up, and I was like, well, that was super weird, but okay. And then 2 weeks before Christmas, I got an email from Children's Wisconsin, actually MCW and Children's, offering me a job to come up to Wisconsin to build an integrative medicine research program. It was literally that random. And I was like, sure, I've never been to Wisconsin. That seems like a great idea. I got up there in February. Jody knows what that means, since she's from the Midwest.
Yes, I do.
It's the worst time of year to go to anywhere.
Yes, it is.
It's terrible. I was like, oh my God, what have I done? This is the dumbest thing I've ever done. But yeah, that's kind of how my thing started with Wisconsin. But I got up there and nobody was doing integrative medicine. So I was like, well, how am I supposed to research this? This is not going to happen. And then, you know, I have to say, part of it was kind of shady on their part, because they wanted to hire a naturopathic doctor, but they didn't want to pay me as a physician. And that was kind of like the backdoor thing that happened. And it happens a lot. And I was like, actually, you know what? You know, this is not going to happen. If you guys want to hire me, you hire me as a doctor. But until then, I'm going back to sunny Arizona. I'm going to enjoy the weather, and you guys can figure it out. So they came back like 6 months later with a contract to consult to build an integrative medicine program. So I did that over the next couple of years. We started seeing patients in 2019. I'm currently the program director of integrative medicine at Children's Wisconsin. We're getting ready to expand that program into the rest of the hospital, because right now it's just in pediatric oncology. I'm technically, my official title is program director of integrative medicine in the Mac Fund Center for Cancer and Blood Disorders. which is a specific center in pediatric oncology. But we're actually getting ready after the credentialing gets done to move integrative medicine beyond pediatric oncology and into the hospital on a larger scale. So that's the goal, is basically to I'm just going to keep shooting around the country, building these programs so that we can have an army of naturopaths all over the US. That's kind of my world domination of integrative oncology. But that's the story with Children's Wisconsin currently.
Wow. Wow. Yeah. Amazing.
One hospital at a time. Indeed.
Yeah, we got to infiltrate.
There you go. There you go.
Very nice. Oh, here's a great question from Avery. Thank you so much for spending your time with us and all you are doing for the field of naturopathic medicine. Very inspiring. I agree. Could you explain the FABNO and certification process? Yeah, let's just dive right into the technical things.
Yeah, so actually I currently am a candidate for FABNO. So the FABNO, it's basically you're a fellow of the Association of Naturopathic Oncologists. It's our board certification for naturopathic oncology. It's not an easy task. Currently, because there are so few naturopaths in North America, there's around 5,000 or less of us. Naturopathic oncology obviously is a really small subset. It is one of our specialties. We don't have a lot of specialties in naturopathic medicine, but we do have around half a dozen right now, and oncology is one of them. So the FABNO process is currently, you have to do a 2-year residency, or you can do, if you don't do a 2-year residency, then you do 5 years and then you sit for your exam. You have to submit cases. A lot of us have been waiting to take the exam because we haven't had critical mass. And the reason for that is we lost a lot of our residencies once Cancer Treatment Centers of America basically closed and then shifted to City of Hope. There's usually around maybe just 4 residencies per year for naturopathic oncology. So when you are considering having to take the exam, so the board, our OncAMP, who is the board that manages the FABNO board certification, they need a certain amount of candidates to have people sit for the exam. We just haven't had critical mass. So a lot of us have just been kind of hanging out. I've been hanging out for several years waiting to sit for the exam. I already submitted my cases. Those have gotten accepted. So we're just big chilling, waiting to sit for the exam. But yeah, you have to have around 2,500 additional hours of training specifically in naturopathic oncology before you're even eligible to sit for the board exam.
Wow.
Does that answer the question, Avery? Do you want some more info? I can wax indefinitely on naturopathic oncology since it's my jam.
That's pretty thorough, though. So definitely a lot more specific training. But now, can you speak? Gosh, Jody, I'm not even looking at our questions, but I'm just so curious.
No, go ahead, Jay. No, please.
The naturopathic oncology, like specifically, how would we know mistletoe for ovarian versus the endometrium? Tell me a little bit more of specifically what kind of research you're doing there.
Sure. Yeah. So for the mistletoe training, just so you guys know too, that's actually a separate training. So you have to do a separate training for mistletoe if you want to be a certified mistletoe provider. Mistletoe, which might sound kind of crazy, but this is actually European mistletoe. It's imported from Germany. Previously, it was illegal to even have it in the United States, and patients were doing all kinds of crazy things to get a hold of it. Currently, and this happened around 5 or 6 years ago, we have a pharmacy in Wisconsin, believe it or not, in Troy, Wisconsin. It's the only pharmacy in the United States that can dispense mistletoe. It's a homeopathic preparation, and it's made from, well, it grows on certain trees in Europe, and each one of those trees is specific for different kinds of cancer. So there's a, helixer A, helixer M, helixer P, and those all have a predilection for different cancers, but you can only use them. The FDA will not get on your case if you only prescribe them to patients that have stage 3 or stage 4 disease. And the reason for that is it's basically just so that patients aren't trying to use a natural therapy in lieu of doing standard of care. And I'm really very much a stickler adhering to that, because I want us for patients to keep having access to this intervention. It extends the life of patients significantly. And so really people that are certified providers, we really try to adhere to that so that patients can continue to have access to this. But yeah, so it works differently for different types of cancers. And also if a patient's getting conventional therapy too, if they're getting chemotherapy and radiation, then you use certain types of mistletoe for those guys, independent of what their cancer is, simply because of the way that mistletoe behaves with chemotherapy. But there's a lot of benchmark data regarding the safety and efficacy of mistletoe. It's been used in Europe for over 100 years. It's kind of a cornerstone of their regular cancer treatments. It's just not been FDA approved here in the United States. Around 4 years ago, Johns Hopkins started a clinical trial, was actually crowdfunded by a gal that got her hands on mistletoe and had a resolution of her colorectal cancer. She actually, she talked to her medical oncologist and she said, look, this has been an amazing thing for me. It saved my life. I want to do a clinical trial so other patients can have access to it. And can you please do it? And he's like, nobody is ever going to give me the money to do this trial. And she said, well, what if I give you the money? And he said, if you give me the money, I'll go to the hospital and say, look, can we do this? So she did it. She raised the money. She crowdfunded the money to do this clinical trial. And I think the data from the phase 2 is actually just coming out. So she did an amazing job. You guys can go on. Her foundation is called Believe Big, and you can read her story. But a lot of patients, it's just amazing for them to have access to the mistletoe therapy, and I use it a lot.
Is it just mistletoe or are there other botanicals?
Oh, our toolbox, if any of you guys on here are interested in oncology, because I'm always trying to recruit students to the naturopathic oncology realm, our toolbox is so crazy big. I mean, I have patients from all over the world that come here to see me to use the modalities that we have. We have a lot of compounded botanicals that you can only get in the state of Arizona. We have compounding pharmacies here. They compound quercetin, they compound EGCG, they compound resveratrol, curcumin, things you cannot get anywhere else except for here. And we use those in convention with the conventional chemotherapeutics. For instance, I use a lot of compounded curcumin for patients that have colorectal cancer. If they're getting FOLFIRI, FOLFIRI is really FOLFOX with irinotecan added. But if you look at the data, when you use curcumin, patients can get through a complete cycle of irinotecan, which is six rounds. Irinotecan is really hard for patients to tolerate. Most patients can only tolerate 2 cycles. If you get them on curcumin IVs, they can go the full 6. And not only do they have a better improved quality of life, it actually can boost the efficacy of the irinotecan. So, I mean, these are things that you can do here that you really can't do anywhere else. My toolbox is ginormous. Which medical oncologists are, I'm not going to lie, they're a little jelly of what we can do, because all they can do is prescribe chemotherapy. I can do all kinds of stuff they can't do. So I have quite a few buddies in the medical oncology realm that are always like wanting to play on our side of the fence. I'm like, yo, dude, you can't do that. It's out of your scope of practice.
Wow. Wow.
Yeah.
So,
Wow.
like, what's an average day look like for you? Are patients coming to you as the last resort? What's the whole day look like?
For me,
All of the
in
above.
particular, yeah, I specialize in stage 4 disease. So advanced stage disease is my
Wow.
jam. I like it. I know that sounds crazy, but it's, I am oftentimes the last stop on patients' journey for sure. But I have the best job on the face of the planet. Like I really do. There's so much that we can do that medical oncologists can't do. And it really changes the lives of people all the time. Even if you can just give them something that makes their nausea better, or they can sleep, or their pain improves. Yeah. That you would be amazed at what effect that can have on a person's quality of life. And it's right. It's just I don't know, I can't tell you, because when a patient goes to see a med onc, they're in there maybe 5 minutes, right? When they come to see me, they can hang out, we visit. I mean, I tell everybody, basically, I just socialize all day. That's really all I do. I just hang out and visit with people.
Wow.
I mean, it really is. It's that fun. It's not, people are always like, oh my God, you do oncology. That's got to be depressing. I'm like, absolutely not. We laugh, we have dance parties, we snack, it's just a very different vibe for integrative oncology than it is when when patients go to get infusion or what have you. But I do practice integratively. I have a very wide reputation for being an integrative provider. So I really do straddle the fence between our side and their side. And I have really good relationships with all the medical centers in the Valley, the cancer centers. I like to collaborate, and that's really, it's all about collaboration to help patients, right? So yeah, all day. I don't see patients early in the morning. Nobody's wanting to do cancer care at 8 a.m, right? My day starts a little bit later because I usually have meetings at Children's in the morning. So, and then just start seeing patients, and it varies. There's a lot of IVs. I have a young doctor that I poached her right as she was graduating, that she does a lot of acupuncture and traditional Chinese medicine for me. I do a lot of procedures like for pain management. My background is in genetics, and kind of molecular diagnostics. So I do a lot of precision integrative care, which means I get all their tumor genetics, I get all their whole genome genetics, and really try to develop a comprehensive approach to their cancer so that it's really patient-centered. It's very, very tumor specific so that we can improve their odds of survival. Because really, when a patient has stage 4 disease, it's a chronic illness. It's no longer, they're never, ever going to get rid of that cancer, right? We just have to manage it. But it is a moving target. So I use a lot of genetics too. So there's all kinds of, my day is never the same. Or no 2 days are the same, ever.
Yeah. What I hear though, and I'm not a doctor, but what I can understand on my low simple brain level is you're looking specifically at those genes and those tumors in the cells of those tumors where typically I think of blood work, when I go to the doctor, it's the basics of, okay, my numbers are this on a chart. You've gotten so much more in depth into the cellular level of what's going on. It's just amazing. Like I've gotten the goosebumps like 4 times.
Yeah, me too. A couple times.
That's my training. I was a scientist before I became a naturopathic doctor and worked for the government for a long time. I actually was trained as a protein chemist at University of Virginia doing integrin signaling, but started doing something totally different for the government. But, cancer is, a lot of people will tell you cancer is not a genetic disease. It is. It's not necessarily an inherited cancer disease, genetic disease, but every cancer is altered at a genetic level. And it's a moving target, right? Because all of the amazing things about us as an organism are exactly the same in a cancer, except it's got a lot of extra stuff that makes it, be able to do things it really shouldn't do. So it's always shifting, because we are designed to take a lot of stress, a lot of challenge, a lot of just basically we're designed to get beat up and we can take it. Cancer cells can do the same thing, and they've acquired a lot of extra skills so that they can go even further. So you always have to be looking at the genetics, see how they're shifting, seeing how the proteins that are being made are giving them, benefits that they shouldn't have. And we have natural therapies to help with that, and that's really kind of what makes it unique. If you want to do oncology training here, like I said, you have access to things that you can't get in other places. You can't do that in Cali, you come here to do it. But yeah, I can look at if they've got P10 or PIK3s or, anything's wrong with the mTOR pathway. I can give them EGCG. I can give them curcumin. We can give them, quercetin. We have all these natural products that can help some of those mutations get overcome so that you can induce apoptosis, or you can induce some of those cascades that, basically help that cancer not function. So yeah, we can drill down. We've got that technology. It's a really exciting time to be a doctor, right? I mean, I can sequence your entire genome in like less than a week. I can sequence your tumor genome in a week. So, I mean, that's insane, right?
Yeah.
Back in 1850, when I was a grad student, we were just like, oh my God, the genome hadn't even been mapped yet. Like we didn't even know, right? So who knows what's going to happen in 5 years?
Right. What is next? Are you going to any of the hospitals in here in the Valley? Like I was thinking back to like, all right, one hospital at a time too. Are we gonna start knocking on doors?
Geez, I don't have time. I've got like I said, I've got buddies at all the cancer centers, and we have really good relationships. I did a breast fellowship with Dr. Hernandez, which was really, really great. I did a year-long breast fellowship with him. So I made a lot of friends at Ironwood, and I refer to Ironwood a lot just because I know people there. But I trained at City of Hope, formerly CTCA, so I refer a lot there. I've got a lot of buddies out there. But I haven't really, because there's so many of us in the Valley, and we have such a collaborative relationship. There really hasn't been a need. But certainly for other places where we aren't licensed and we don't have a presence, those are the places I'm targeting. I'm like, yeah, let's get our people in there, right? Let's get some licensure popping. Let's get some things going.
Yeah.
Because people need access to this medicine.
Yeah. Everywhere, every day.
Yeah.
Yes, ma'am. Yes, ma'am. All right, guys.
Totally
I mean, this
agree.
conversation's been fantastic. We need some questions.
I'm just
You're just sitting there listening and smiling and nodding your heads with us. Come on, give me some questions here.
I see something from Rose. Residency and fellowship. Well, like I said, the residency is more clinically focused. So when you do a residency, it's like you are there, you're their slave. You're going to be doing all the scut work for sure. But it's all clinically related. And the fellowships, they're a little bit more, they tend to be more related to the research aspect. And we really don't have enough fellowships. Yes, we need more residencies, but dang, we really need some fellowships, because it's so important for us to do the research and get the data out, right? Because a lot of the reasons that we don't have studies are because conventional providers don't know how to do them. You can't really apply the same standards for a genomic study or just a regular drug study as you can with a natural product. It doesn't work the same way, so you can't use those same standards. So we really need to be training naturopathic physicians how to do the research. And there's really just a handful of us that do clinical research to get the data out. So we need more of the fellowships. I haven't started working on that project yet, but somewhere down the line, I'm going to start pimping people to give us fellowships.
Nice.
What are your thoughts about German New Medicine? I actually don't know what that is. German New Medicine. I don't know what that is. What is that?
That came from Erica. So Erica,
Where you
how much do you know
Erica?
about it?
Hi. So German New Medicine it's the name of this way of treating cancer. It was basically developed by an oncologist in Germany who he lost his son and the son was like 18. He was killed I guess he was accidentally killed. And then a couple months later he developed testicular cancer. And because he was an oncologist, he started to think like, well, I wonder if all my other patients have some sort of reaction to trauma as well. So he started to ask his patients, and he started to see patterns. And basically, like, it's not so basically, like, there's a trauma, and then the body registers it as cancer someplace, and there's also a place in the brain. He kind of mapped out the brain and realized that the cancer is in very, very particular areas. And the way to heal it seems to be to incorporate acknowledgement of the trauma and to sort of like understand what had happened and to sort of resolve that.
I've heard of permutations of that, but I haven't heard of it actually called the German New Medicine. But I mean, there's a lot of data related to how feelings can manifest as cancer, and there's books about it. I haven't necessarily clinically seen that I've been able to remedy a cancer when we address the trauma. I mean, it is certainly something that I do. I mean, it's You have to, if you're going to practice whole person medicine, you have to acknowledge the mind body piece and the mental emotional piece of the vessel and us as a human, right? I haven't ever had any success in having patients address those problems and it resolved the disease. But again, I also do stage 4 disease. So, you know, in my experience, once that cancer has left the building, which is typically it's, you know, when I say the building, the primary location of the cancer. And once that disease is able to get out and establish itself in other areas, it's never something those patients are going to get rid of. But, you know, I would also say by the same token, not all stage 4 is created equal, right? I mean, your tumor burden can be drastically different and you still have stage 4 disease. I could have a patient with stage 4 disease and they just might have a 2, you know, centimeter lesion in their liver. And then I can have, and that's stage 4, or I can have a stage 4 patient that's got liver lesions, lung lesions, bone lesions, you know, their tumor burden's a lot higher. So, you know, that's also not to say that all stage 4 is created equal, but I've never been able to, I would love for that to happen. If patients could address their trauma and have their disease resolved, that would be amazing. You know, and I could be out of job and I'd be super happy about that. I just go to the beach. But yeah, I haven't had any success with that, but I also haven't practiced that specific form of medicine. Nutrition on a clinical basis for your patients. Oh, dang. The nutrition question. Students hated this conversation when I was a professor. My approach to nutrition is a little bit different than other naturopathic physicians simply because I do stage 4 disease. So I'm just going to give that disclaimer before I tell you what I'm going to tell you. So a lot of patients, when they get a diagnosis of cancer, whether it's stage 1, stage 4, the first thing they do is change their diet, right? That's not always the best thing, which might seem a little counterintuitive, but when a patient loses a ton of weight, because they're already losing weight because they have cancer, right? That's one of the first telltale signs. And then they put themselves on a diet and they lose a lot more weight. And then they go into treatment underweight, their prognosis is actually really poor. Because it's a very slippery slope for patients to get skinny and to do treatment and then have no buffer. So I don't actually put patients on a diet. I don't villainize food. I mean, obviously, I don't want them eating Twinkies and donuts 24/7 or drinking pop or any of the other things that they might want to do. But I'm also not going to take something away from them. And I could go on a very long-winded spiel about sugar and cancer, but I'm not going to. But I'll just say that I don't villainize food and I don't take food away from them because there's so many things attached to food. There's culture, there's feelings, there's, you know, emotions, there's a lot of things tied to food. And when a patient is really, really sick with a disease that can kill them, the last thing I'm going to do is take away something that comforts them. And I also need them to eat. So I don't, you know, I worry about the nutrition piece from after they get through the cancer piece. So then we clean things up on the rear end if we need to. But I really I leave the nutrition alone while they're actively getting treatment, because like I said, they can get on a slippery slope. And actually, when patients are underweight, it's very easy for them to become cachexic. And once that happens, you know, the data shows they only live 3 more months, so it's really slippery slope. So I don't mess with it.
I think we skipped one. How do you see the scope of naturopathy increasing across the US in the next few years?
Geez, I hope it blows up, right? If the AANP, which is our national board, is successful in petitioning the Social Security Act to add us, it will absolutely go bananas. But that's the first step that's got to happen. There's quite a few states right now that have pending licensure, but they are battleground states. New York has been a battleground. Virginia has been a battleground. Florida has been a battleground. There's a lot of really tough states that are up for licensure, and I have no idea how it's going to go. But these are states where people have been battling for like over a decade. But what we've really got to do is get Social Security Act changed. If we can do that, it won't make any difference because then we'll get licensed federally, just like a DO or an MD. I don't know. I'm hopeful that maybe in the next 5 years that can happen. I'm pushing for sooner. Obviously, I'm going to keep doing my part. That's tricky. I don't know. I really don't know. Our political landscape's so volatile right now. There's no telling. Let's see. What else can I tell you guys?
Let's see. What's the difference in efficacy with naturopathic interventions in late stage patients versus early stage?
Oh, geez, that's a great question. It's a really good one. And it's overall, if a patient uses natural therapies with an earlier stage disease, they're going to have much better outcomes, right? Later stage, maybe 20 to 30%. There's no amount of naturopathic fairy dust that's going to help a patient with stage 4 disease. That's really just the long and short of it. There's a lot of things we can do to boost efficacy of conventional therapies. And, you can talk to other naturopaths and they'll say something totally different. For me, as an evidence-based physician, I only practice evidence-based medicine because I'm a scientist. I only see 20 to 30%, which is not enough, right? They need the full thing. So I need the big guns from chemotherapy. Because really, when you think about natural therapies, there's no plant on our planet that does just one thing. Plants do a lot of things. Yeah. And that's one of the reasons that their efficacy is so low when you apply it to disease, because once we put them in the body, they don't do just one thing. And that's why chemotherapy is really good, because it does just do one thing. It goes in there, it does the one thing, and it gets into every single cell. And natural products don't do that. They're not designed to do that. They're designed to do a lot of things. They're immunomodulatory. They do touch on a bunch of systems. And when you have cancer, we really need them to just do the one thing. And so the efficacy is drastically different. But when you add it to conventional therapies, you can really, if a conventional therapy is around 70 to 80% effective, once you add that natural product, you can boost it to almost 100% efficacy, which is what I see a lot. What else can I tell you? I hope I'm recruiting the naturopathic oncology students right
now. Perfect. So we've got, as a naturopathic oncologist, do you often follow up with naturopathic treatments to help people recover once they're in remission?
Oh, yeah, absolutely. Typically, it takes a patient around a year to get back to baseline after they've had chemotherapy, if they can get into disease remission. If they're not, if they're stage 4, which is most of my crew, we usually, what I have patients do is they just cycle on and off of treatment, right? If they can. Some patients can't do that. With my colorectal patients, you've got to stay on top of it. And those guys just get really worn out because they've got to get chemotherapy all the time. But, with some of the other patients that don't have as much tumor burden, we can just give them a little bit of, Keytruda here, a little bit of radiation there. So when they're in between therapies, we try to clean up the terrain as much as we can, so that we just manage it like a chronic illness, which might sound a little bit crazy, but that's really what we do. Because like I said, you're never going to be able to completely eradicate a stage 4 disease, especially when it's in multiple organs, but you can manage it. So you got to do what you can do in between the therapies, but we clean up the nutrition, we clean up, try to clean up whatever environmental exposures that they're having and, put them on a maintenance protocol with natural products and all the things. It's a full court press. But also understanding that patients are human beings and they get tired. Patients that have stage 4 disease that are that ill, they don't want to have to be on surveillance all the time, right? They don't always want to have to be worrying about what their disease is doing. So it's a really, fragile balance between having them be able to live their lives, but also manage their disease without thinking about it all the time.
Yeah.
What else can I tell you guys?
All right. So I want to go back. You're trying to recruit these folks. So give them some specifics. What's the best thing they can do to prepare for ND school they're about to start? And as they go down their ND journey, how do we really cater towards becoming a naturopathic oncologist? I know you had mentioned specific shadowing, field observing, but give us the roadmap.
Yeah. That's really what the thing is, when you first come to medical school, you're going to learn all kinds of stuff. It's going to blow your brains, right? just crazy stuff, which, once you become a naturopathic doctor and be like, oh my God, that was so obvious. Why didn't I know that? Or why didn't I think about that or whatever? So your first year, you're just going to basically, your brain's just going to be blowing all the time because you're going to learn about all kinds of things. But once you kind of get over that hump, because as you go into your second year, you're going to start entering the clinic. And that's really when you need to start seeing and thinking about, what modalities are really resonating with you. I use homeopathy a lot for a lot of reasons, but I was already into homeopathy before I ever started naturopathic medical school. I didn't even really know what it was, but I played with it. And then when I got here, I was like, oh my God, this is amazing. But whatever modalities start resonating with you, like if it's botanical medicine or it's a physical medicine, just kind of be aware what that is. And then start thinking about how does that going to play into what you're going to look like as a physician, what you might want to do. Because a lot of students do come to medical school with kind of an idea about what they are interested in, and if that stays the same after your first year, then really start charting a course and start reaching out. I can't tell you just basically from day one, you need to start doing it. Because as a busy physician, I really do try to make time for medical students, but a lot of people don't. And sometimes I don't even have time. So to get on a doctor's radar, to spend time with them, start doing it as soon as you can. Because that's really going to be where you're going to learn some things you won't always see in the clinic. Because when you're in the clinic, you've got to see patients. There's a million things that we want you to do. So the last thing you're going to be thinking about is what I'm going to do when I'm leaving the clinic, because you're just trying to survive clinic, right? And OSCEs and, your all of your milestone exams. So you're really going to be distracted by other things because you need to graduate. But, if you can, just kind of keep those things in mind, write it down. When I was in medical school, my first year, this guy came to talk. He gave a talk, and his name was Dr. Arthur Lee. He was from Yale University. And I was a gunner, and I was like, oh my God, I want to spend time with you. I went up and talked to him after his talk, and he's like, no, it's too soon. Don't talk to me right now. If you still think you want to talk to me, you reach out to me when you're fourth year, and then we'll talk again. So I wrote his name down, wrote his email down. I bugged that man for 4 years. And I eventually ended up at Yale University. But you just got to do stuff like that. You got to bug them, stay on the radar, let them know you're interested. But you got to start doing that stuff like as soon as you can, and then try to do it throughout your whole career. And then really start, the name of the game is residency from day one, because you want to be competitive candidate. You want to get a job, all those things. You really just kind of have to be a little bit more aggressive about charting a course from day one. I know that's kind of a pain because you're trying to go to medical school too, but it's a really competitive profession. So you got to keep your eye on the ball as soon as you can. Is that good enough, Jane? Or
that was outstanding
Yeah,
advice. Absolutely.
great. Absolutely.
Jody, what do you got?
Yeah, what you
No,
got?
let's do that one last question.
I just thought, yeah, go ahead.
Yeah. So one last question here. How do you balance giving someone and their families hope with the reality that they may die? I see that sometimes loved ones are angry with the healer for the false hope they were given.
I don't ever give false hope. I give data.
Okay.
I always present patients with the data. I don't ever, how they want to interpret that is really up to them. But, when a patient comes to see me, they've got stage 4 disease. I'm like, look, here's the dealio. No amount of naturopathic fairy dust is going to cure you. I'm not your gal if that's what you're after. And also, you're never, ever going to be disease free. That's just the nature of the beast. Those are things that are really important to consent patients. I have the same conversation with every single patient that comes through my door. If you're looking for somebody that's going to give you a silver bullet, I'm not your person. I have somebody I'll refer you to, but I'm not your girl. I practice integratively. I actually don't have any patients that aren't on conventional therapy too. I just don't take those patients.
Right.
If by chance they're stage 4 and they're palliative care, and I just need to walk them home, I'll take those guys. But I don't, patients that want a cure that doesn't exist, I'm not their person. So I'm just really honest with patients, because the thing is, if you're not honest with your patient, they can't make informed decisions about their healthcare. So I'm just super honest, and I would say 95% of the patients that come to me because they want something different, and they thought I was going to give them a silver bullet, they actually will get conventional care. I don't ever coerce anybody. I just tell them what the data is. You know, just gotta be honest. That's your job. Docere. That's one of our jobs as a naturopathic
Docere,
physician,
yeah.
is teacher.
Dr. Havens, you've been amazing.
You're
Thank you so
awesome.
much, everybody. It is 1:00. We are right on the dot. This was incredible. Thank you for sharing your wisdom,
Yeah.
your
Thank
your
you
incredible
so much.
experiences.
I
Wow.
hope I got some naturopathic oncology people.
So do we.
But you know, if anybody has questions or you ever want to reach out, these guys have my contact info. I'm always happy to talk to you
Absolutely.
guys. Yeah.
Greatly appreciate
Absolutely.
it. Thank you, Dr. Havens.
Yeah.
Thank
You guys
you
have
so
a great
much.
day.
Have
All
a great
right.
afternoon. Bye,
You
everybody.
too.
Bye, everybody. Mhm.